the Evo Smart system is a compact machine that carries an outstanding efficiency and performance with the ability to perform incompatible with the ability to perform a very high efficient fluidic system and ultrasound system. And in addition to the 23 vitrectomy, anterior vitrectomy, and also the compact machine that can be transferred to another places if you want. Regarding the Agile Fluidics, this system will efficiently control the intraocular pressure inside the eye dynamically, and with this active fluidics, you can control every step inside your procedure during the phacoemulsification. This can be done through a set of controlled irrigation. This set will pressurize air inside the rigid bottle. This bottle is not a plastic bottle, not compressed from outside. It is pressurized from inside, so that should be rigid. And the EasySys cassette. With this Agile Fluidics, the machine, there is a sensor over the aspiration line. Whenever there is a change in the vacuum, the machine will send feedback into the bottle, with pressurizing the bottle to the maximum of 20 millimeter mercury in case if the vacuum reached 400 millimeter mercury and above, so that there is dynamic control of the intraocular pressure by adjusting the intraocular pressure with this pressurized system, whether with the increased vacuum or decreased vacuum. If the vacuum is decreased, this pressurized system will stop. Whenever the vacuum will increase, it will push more and more air into the bottle to pressurize the anterior chamber. And this will control the anterior chamber and will avoid surge and will mitigate surge whenever it happens. Not only this, but also the rigid tubings of the system. This rigid tubing is 1.3 millimeter, and as well as the flare tip. We all know the flare tip. It is large from at the head part. With this large at the head part, it will emulsify more efficiently, and due to the narrow shaft, this will resist the outflow from inside the eye. With this resistance, it will hinder the surge. And if we look there to these graphs to the right side, the upper one is the high surge with a standard tip and the gravity system, while the middle one with a flare tip and the gravity system, the lower one which is the least surge amount with the Agile Fluidics and the flare tip. So that this also the rigid tubings and the flare tip will enhance more into control of surge and mitigation of the surge. Not only this, but also the difference between the irrigation line between the gravity system and the Agile Fluidic system. It is 40% less in length than the gravity system, so that it will help the anterior chamber more faster than the gravity system, and it will aid into mitigation of surge. And this will be highlighted here in this graph, that with the Agile Fluidic system, there is amount of intraocular pressure will be increased inside the eye between the occlusion time and the occlusion break. At this moment, there is increase in the intraocular pressure, so that the amount of surge will be less in time and less, and the intraocular pressure at the time of surge, it will be away from the dangerous intraocular pressure area where the posterior capsule may potentially open, as in the gravity system. And here this is a case to demo how the anterior chamber is extremely controlled with the Agile Fluidic system. I'm doing the regular capsulorhexis 5 millimeter, then doing a hydrodissection. All my videos in the presentation is accelerated into 1.2 speed. Then I'm doing a hydrodissection, then pressuring down over the nucleus to make the fluid move into the periphery, then doing dialing of the nucleus to separate all the nuclear material from the capsule, and dialing many times. Then I start to shop the nucleus. Here I'm removing the upper cortex. Look for the stability of the anterior chamber in all the steps of the phacoemulsification. Now I'm doing a quick chop, dividing the nucleus in two halves. And one of my strategy during phacoemulsification is to minimize the fragment size as possible as I can to help any machine to work efficiently inside the anterior chamber and to decrease the amount of surge, especially when the machine itself will having a controllable fluidic system like the EvoSmart with the Agile fluidic system. And what's adding to the stability of the highlighted here, that I'm putting the bevel down, facing the posterior capsule, and I'm not afraid at all because the anterior chamber and the bag is extremely stable up to the last part of the epinucleus and cortex. As you are seeing here, everything is stable. The posterior capsule is away from me because the intraocular pressure is extremely controlled, and it is away from the dangerous spot of intraocular pressure whenever it is very low for the posterior capsule to come into the tab. And this is a regular case. Then the second strong point with the EvoSmart is the mini stress technology. This is a patent technology for BVI. With this patent technology, the tip can act more efficiently even in hard cases and in all grades of cases. How does it work? There is a sensor that will send feedback. There is usually the machine feels the handpiece and it gets regular feedback from the handpiece to see how the tip is moving forward and if it is taking the whole stroke adjusted or programmed over the machine before the surgery or not, and accordingly it will correct this stroke into the programmed level. And if you see, look here, this is the mini stress system, and this is the traditional phaco system. Here, both of them is encountering a nuclear material, but the traditional phaco system, there is lag in the stroke so that it cannot reach the whole trip facing the nuclear material. But with the mini stress system, it feels how this cataract is hindering the stroke of the tip, and it will augment this and adding more into the phaco tip to move forward to have the whole stroke adjusted pre-operatively. And to have this with the traditional phaco, you have to increase the level of your programmed ultrasound level to reach what is efficient with this hard cataract. And now we are going to see how this is work with a very hard cataract like this. This is a grade 4 plus nuclear cataract and almost pronasal. And now I'm dialing the nucleus as I do usually. And there is no difference at all between the technique, what I'm doing in soft cataract and in hard cataract. This is because of the efficiency of the machine regarding the Agile fluidics and the mini stress technology. And if you look there, the ultrasound I'm using is 40%. With the help of the mini stress, I can perform efficiently with such cataract. I'm showing the nucleus as I used usually, doing a quick chop. And if you saw that the machine has a very good occlusion with the nuclear material so that I can chop efficiently. Now I'm aspirating or emulsifying the nuclear material. If you look, it will be emulsified very fast, although the power is only 40%, so that the stroke is very efficient due to the minimal stress. And I'm not afraid after removing the first parts of the cataract, then I'm everting the tip with the bevel down, facing again the posterior capsule with too much safety. And if you look, the material is engaged properly with the phaco tip. There is no repulsion that usually encountered with the longitudinal ultrasound. As you see here, there is no that repulsion we encountered with the longitudinal ultrasound. As I said, look, the nuclear material is extremely adherent to the phaco tip with just gentle maneuvering of the nuclear material to be very close to the phaco tip up to emulsifying this part. This is the beauty of the EvoSmart system with the Agile fluidics and the mini stress ultrasound technology. Here again, the same, it's a very hard piece, and it is tumbling over the tip up to finishing this part of the nucleus. And here again and again, up to the last part of the nucleus with the phaco-tip bevel down, facing the posterior capsule without any fear of opening the posterior capsule, as you'll see at the end of the surgery, up to getting a very clear bag with no cortex or epinucleus. Okay, do you think I'm really inside the bag or I'm moving outside the bag? To highlight this, we have to go into a more complicated cases to see what's going into what's happening inside the eye. Let's just to talk about a hypermature cataract and see what is going on inside the anterior chamber. This is a case of a hypermature cataract, doing my incisions, then just pushing a stain into the eye under the air bubble, doing it with the insulin syringe immediately and dripping the stain over the anterior capsule, then injecting the OVDs, then immediately puncturing and instantaneously aspirating the liquefied material, milking the liquefied material from the periphery into the center, then fashioning a 5 millimeter capsulorhexis as you see here. Then after the capsulorhexis, without any hydrodissection or hydrodilation, I'm facing this hard nucleus. And if you look to the side view, this is the anterior view and this is the side view. It is simultaneous motion, so that I'm shoving first this hard nucleus inside the bag, as you see here, but you cannot see anything in the side view because everything is happening inside the bag. Dividing the nucleus as usual, and have a look how it is a very strong occlusion. The nucleus is come very fast into the phaco-tip to be able to shove this hard nucleus, sweeping the tuber at the equator of the nucleus, then after that starting to emulsify. Look, where is the nuclear material? This is a hard nuclear material. I should go away from the endothelium of the cornea to make sure that I'll have a clear cornea in the first day post-operative, so that everything coming up, the tip will take it down into the bag away from the cornea, but giving a space for this nucleus just to emulsify, whether outside, whether just at the papillary border or inside the bag. Then going into a cornea with some gatata and low endothelial count, and also showing the side view and highlighting how the machine is very stable to emulsify inside the bag without fear from the posterior capsule. And the only thing that I'm afraid from is the endothelium, because this cornea is compromised, and if I go beside the cornea, emulsifying and the nuclear material, doing a friction with the endothelium, I lose too much endothelium in these eyes, and I'll have a bad result, and the patient will not be happy in the post-operative time, and I may need a cornea surgery after that. Just look to the nuclear material, how it is away from the endothelium, and the bag is extremely stable, so that with the bevel down, you can emulsify this nuclear material inside the bag away from the corneal endothelium. This is due to the Agile fluidic system, which is making the anterior chamber is very stable. The posterior capsule is extremely away from the phaco-tip. Whenever there is surge, the intraocular pressure inside the anterior chamber is extremely away from the dangerous zone of the intraocular pressure. As you can see here, the phaco-tip is inside the bag. Everything is inside the bag, emulsified, not going into the anterior chamber, highlighting how far this machine having a very stable intraocular pressure and a very stable fluidic and fluidity inside the eye. Here, this is the last part, I think. No, still, there is, as you see, the nuclear material does not go above into the endothelium of the cornea, and everything is happening backward inside the bag. If something came up, the tip will take it down into the bag again, up to the last part of the epinucleus and cortex, as you can see. And now this is the last case and the last complicated case, which is subluxated cataract. In subluxated cataract, this is not too much subluxation. There is weak zonures around 120 degree of subluxation. Here, with such cases, we have to lower the intraocular pressure, not the one I used to use, so that the intraocular pressure here was around the 35 up to 40, and the flow rate and vacuum is lower. The flow rate was 20 fixed, and the vacuum was 200 millimeter mercury, using the Agile Fluidics as well and the mini-stress, so that I'm a little bit slow, and then emulsifying the cataract as usual in the previous cases without any fear for the bag or for the stability of the anterior chamber, as I lowered everything, and as well as the intraocular pressure. But due to the Agile Fluidics, everything will be controllable. And as you see with this Tambellini posterior capsule, there is nothing will happen, because everything is stable inside the eye due to the active fluidics of the EvoSmart machine. And I'm keeping this part of the nucleus here at the subluxation side, just to support the posterior capsule up to finishing the other part. Then I'll facing this part after that. Then emulsifying this part as well, taking this large mass which I was supporting the capsule with that, and this subluxated zonures. Then this is a large part. I'm taking it very slowly with the bevel down. I'm not afraid from the posterior capsule, and for more safety, I'm putting the tuber under the phaco-tip and under the nuclear material of the posterior capsule, because it is a Tambellini posterior capsule and there is no stretch over it with the zonures. It may come. And here, this is an escaped part of the nucleus, taking it from the equator of the bag. And finally, I can finish without any harm to the posterior capsule with the extreme stability of the anterior chamber. To go outside, I have to inject OVTs before. So the take-home message: the dynamic intraocular pressure compensation of Agile Fluidics keeps anterior chamber stable, effectively mitigating surge during phacoemulsification, and this is particularly important in a very difficult cases like subluxated and weak corneal endothelium. Also, the mini-stress system makes the hard cataract is an easy cataract, due to this technology, always ensuring consistency between the programmed and the actual phaco-tip stroke. The instantaneous intraocular pressure compensation and the ultrasound feedback provide the maximum safety and efficiency, furthermore beneficial in a complicated cases, as you saw during my presentation. In a different complicated cases, the machine was very stable and efficient regarding the Agile Fluidic system and the mini-stress technology. Thank you very much.